Good morning, everyone. We are going to tackle influenza. What is influenza? Influenza is commonly referred to as the flu. It is a highly contagious viral infection of the nose, throat, and lungs that occurs most often in the late fall, winter, and early spring. Infection usually lasts about a week and is characterized by a sudden onset of high fever, aching muscles, headache, non-productive cough, sore throat, and rhinitis. Influenza is a viral infection that attacks our respiratory system, our nose, throat, and lungs. Agent. Influenza viruses are classified within the family of Orthomyxoviridae. There are three types, namely influenza type A, type B, and type C. Only virus type A and B commonly cause illness in humans and cause seasonal epidemics of disease. Orthomyxoviridae is a family of A negative sense RNA viruses. There are 7 genera, but only 4 of them contain viruses that cause influenza. These are the alpha influenza virus, which infects humans, birds, and causes all flu pandemics. Beta influenza virus, which infects humans and seals. The third one is the delta influenza virus, which infects pigs and cattle. And the last one is gamma influenza virus, which infects humans, pigs, and dogs. And now, we will proceed in the types of influenza. Influenza A virus are further classified into subtypes according to the combination of the hemagglutinin and the neuraminidase, the proteins of the virus. Currently circulating in humans are subtype A, which is the H1N1, and A influenza viruses. Hemagglutinin and neuraminidase are two large glycoproteins found on the outside of the viral particles. The H antigen initiates infection following attachment of the virus to susceptible cells, while the N antigen is responsible for the release of the virus from the infected cell. The next one is the influenza B viruses. Influenza B viruses are not classified into subtypes but can be broken down into lineage. Currently circulating influenza type B viruses belong to either V. Yamagata or V. Victoria lineage. Influenza type B are usually found only in humans and can cause morbidity and mortality among humans, and it is less severe than influenza A viruses. And the last one is the influenza C virus. Influenza C virus, it is detected less frequently and usually causes mild infections. This does not present public health importance. Influenza type C can cause illness in humans and pigs. This virus lacks the multiple subtypes found in influenza A, which limits its ability to mutate. Next, this is the differences between influenza types A, B, and C viruses. Host range. In influenza A, humans, pigs, horses, birds, marine mammals. And in influenza B, humans only. And influenza C, humans and pigs. Epidemiology. Influenza type A viruses undergo both kinds of changes. The antigenic drift and shift, while influenza type B and C viruses change only by the gradual process of antigenic drift. Clinical features. Influenza A may cause pandemics with significant mortalities in affected young people. Influenza B, severe disease generally confined to elderly or high-risk pandemics. and influenza C, mild diseases common in children without seasonal. Next, the reservoir of infection. The major reservoir of influenza virus exists in animals and birds. Many influenza viruses have been isolated from a wide variety of animals and birds. Example: swine, horses, dogs, cats, domestic poultry, and wild birds. Humans are the primary reservoir. Animals' reservoirs are suspected as source of new human subtypes and may occur particularly when people and livestock interact closely. Next is the source of infection. The source of infection usually is a case or subclinical case. During epidemics, a large number of mild and asymptomatic infections occur, which play an important role in the spread of infection. Next is the period of infectivity. The virus is present in the nasopharynx a couple of days before and a couple of days after the onset of symptoms. Next is the host factors. Age and sex. It affects all ages and people of both sexes. The highest mortality rate during an epidemic occurs among certain high-risk groups in the population such as old people, infants, and persons with diabetes or chronic heart disease, kidney and respiratory ailments. Also, the host factor is human mobility and immunity. Next is the incubation period for influenza. The incubation period is about 18 to 72 hours. Next, the pathogenesis. The virus enters the respiratory tract and causes inflammation and necrosis of the superficial epithelium of the tracheal and bronchial mucosa, followed by secondary bacterial invasion. Signs and symptoms of influenza: fever, cough. Cough is usually dry, headache, dizziness, muscles and joint pain, severe malaise, sore throat and runny nose. Diagnosis: a sample is taken by wiping the back of the patient's nose or throat with a cotton swab or having the patient blow his or her nose. A rapid diagnostic kit is then usually used that establishes a result in about 10 minutes. Symptoms are not always clear in newborn babies and it can be difficult to make a clinical diagnosis. The increase in use of rapid diagnostic kits has made it possible to diagnose the flu with more certainty. A clinical diagnosis can be confirmed by culture or antigen testing of appropriate respiratory specimens, such as nasopharyngeal aspirate or nose and throat swabs, taken within 5 days of onset. It can also be confirmed by serology performed on blood specimens taken during the acute and convalescent stage, but this is less useful for clinical or outbreak management. Next is the treatment. Usually, you will need nothing more than rest and plenty of fluids to treat the flu. But if you have a severe infection or are at higher risk for complications, your doctor may prescribe an antiviral drug to treat the flu. The drugs can include the Tamiflu, the Relenza, Rabipur, and Sofluza. These drugs may shorten your illness by a day or so and help prevent serious complications. Prevention. Influenza is the only respiratory virus preventable by vaccination. Wash hands by washing with soap and water or use hand sanitizer. Cover your mouth and nose with a tissue when you cough or sneeze. Don't touch your face with unwashed hands. It's the easiest way for germs to enter your body. Smiling and laughing can help boost your immune system. Eat healthy and balanced meals to strengthen your immune system. Exercise boosts your immune system and recovery from illness. Stay home until your fever is gone for 24 hours without using fever reducing medicine. That's all. Thank you.